With the efforts of Presidents Truman, Kennedy, and Johnson, the wheels were set in motion. Now the government, the federal government, had a clear role as a payer in the U.S. healthcare system. What happened in the few years just right after Medicare and Medicaid were put into place was a tremendous expansion in coverage and also an increase in payment by the government for healthcare services. That created a new question for subsequent presidents. How were they going to deal with an increase in the costs of healthcare that were being borne by the federal government? And what did that mean for people who were still left out, those who still didn't have coverage? Let's take a look now at what Presidents Nixon, Ford, and Carter did with these dilemmas. In 1968, former Vice President Richard Milhous Nixon was elected president, 6 years after he had indicated that he was finished with politics. With the challenges of finding resolution to the war in Vietnam, Nixon's initial agenda was primarily focused on international affairs. But Nixon was also the first president to assume office with Medicare already in place, and managing the U.S. healthcare system was already a critical domestic issue. Once remarking that the office of the presidency is in a continuous campaign, President Nixon's advisors went to work to draft a Nixon healthcare plan ahead of the 1972 election. With a 1971 poll reporting that 80% of Americans were concerned about increasing healthcare costs, the president's plan would ensure that President Nixon offered an alternative to Democratic proposals for universal coverage being advocated by Senator Edward M. Kennedy. President Nixon announced his plan in February of 1971.
I am proposing today a new national health strategy. It helps more people pay for care, but it also expands the supply of health services and makes them more efficient. It emphasizes keeping people well, not just making people well. The purpose of this program is simply this. I want America to have the finest health care in the world, and I want every American to be able to have that care when he needs it.
Nixon's plan was a stark contrast to the Kennedy plan that called for national health insurance similar to Social Security. Structured around reforming the private insurance system, it would expand coverage for low-income Americans and, for the first time, mandate that private employers have health insurance for their employees. President Nixon's plan also introduced the idea of a national network of health maintenance organizations, or HMOs, to help control costs. But with his attention refocused on his re-election campaign and more pressing international challenges, the urgency of passing the plan faded. Entering his second term with the largest landslide victory in presidential history, Nixon shifted his attention back to healthcare reform, introducing the Comprehensive Health Insurance Plan during his 1974 State of the Union address.
The time is at hand this year to bring comprehensive, high-quality health care within the reach of every American. I shall propose a sweeping new program that will assure comprehensive health insurance protection to millions of Americans who cannot now obtain it or afford it, with vastly improved protection against catastrophic illnesses. This will be a plan that maintains the high standards of quality in America's health care, and it will not require additional taxes. Now, I recognize that other plans have been put forward that would cost $80 billion or even $100 billion, and that would put our whole health care system under the heavy hand of the federal government. This is the wrong approach. This has been tried abroad and it's failed. It is not the way we do things here in America. This kind of plan would threaten the quality of care provided by our whole health care system. The right way is one that builds on the strengths of the present system and one that does not destroy those strengths. One based on partnership, not paternalism. Most important of all, let us keep this as the guiding principle of our health programs. Government has a great role to play, but we must always make sure that our doctors will be working for their patients and not for the federal government.
This new plan came very close to congressional compromise, even attracting support from Senator Kennedy. But with the controversy surrounding Watergate reaching a dramatic climax, the new plan would not see congressional passage as Nixon resigned 6 months later in August of 1974. While President Nixon's proposal was not enacted, it created a framework that would guide future attempts for U.S. healthcare reform. That year, Gerald Ford stepped into office amidst controversy and scandal following Nixon's resignation. Ford's decision to pardon Nixon was often described as an opportunity for him to shift the nation's focus from Watergate to the pressing domestic and international challenges that the United States faced. Although he was able to refocus the nation's attention on many of these issues, President Ford's short time in office did not enable him to continue to advocate for President Nixon's comprehensive health insurance plan. However, the importance of reforming the U.S. healthcare system was not forgotten, as President Ford acknowledged the challenges facing our system in his 1976 State of the Union address.
We cannot realistically afford federally dictated national health insurance providing full coverage for all 215 million Americans. The experience of other countries raises questions about the quality as well as the cost of such plans. But I do envision the day when we may use the private health insurance system to offer more middle-income families high-quality health services at prices they can afford and shield them also from their catastrophic illnesses.
Succeeding President Ford, Jimmy Carter entered office committed to keeping his campaign promises. With a growing urgency to address the need for reforming the healthcare system, Carter made a campaign commitment to national health insurance as part of his administration. When it came time to make good on his promise to reform the healthcare system, President Carter broke ranks with Senator Edward Kennedy. Kennedy advocated for a single comprehensive bill that would provide national health insurance, while President Carter felt that an incremental approach would yield more control over increasing costs. Carter's incremental proposal in many ways mirrored that of President Nixon, and with intense opposition from Senator Kennedy, the Democratic Party began to fracture. Senator Kennedy reiterated his resolve that health care for all Americans was a right and not a privilege during an appearance at a midterm party convention in Memphis, moderated by a young Governor Bill Clinton.
I had a son that was touched by cancer. Extraordinary health bills that we were able to afford, and we received the very best. It would have obliterated and wiped out the savings of any family, mortgaged their savings, and mortgaged the education of their children into the future. 7 months in the hospital I was with a broken back and received the very best of health care. I've been able to receive it for myself and for my family. Just like all of us who are on the tip of the iceberg, way up high in the healthcare services. We've got the very best, all of us at the tip of the iceberg. But I want every delegate at this convention to understand that as long as I'm a vote, and as long as I have a voice in the United States Senate, it's going to be for that Democratic platform plank that provides decent quality of health care, north and south, east and west, for all Americans as a matter of right and not of right.
With two coalitions putting forward their proposals, President Carter released his administration's national health plan during a White House briefing in June of 1979.
Today I'm proposing to the Congress a national health plan. This major initiative will meet the most urgent needs in health care of the American people in a practical, cost-efficient, and fiscally responsible manner.
Similar to the Nixon plan, President Carter proposed catastrophic insurance, required employers to provide health insurance, and set up a new federal program that would expand Medicare and Medicaid to include the uninsured. By the time his proposal was rolled out, however, Carter's support in Congress had waned, And facing a primary challenge from Senator Kennedy in 1980, Carter's national health insurance plan did not move forward in Congress. Steadfast to his promise to provide national health insurance, President Carter continued to advocate for the plan throughout the 1980 presidential campaign.